Act, which was signed into law yesterday by President Biden. Thanks to this landmark legislation, millions of Americans 50 and older are now one step closer to real relief from out-of-control prescription drug prices. This law allows Medicare to finally negotiate lower drug prices for the first time ever. Within Medicare, it limits what seniors will have to pay out of pocket for their prescriptions to $2,000 a year, and it caps insulin copays in Medicare at $35 a month. Additionally, it will penalize drug makers for increasing their prices higher than inflation. AARP Arizona represents almost 900,000 members. And in concert with and support of AARP, our members and our wonderful volunteers have reached out to our congressional leaders through letters, emails, text, phone calls, and in-person meetings to encourage them to take action. They have voiced their concerns, they have shared their experiences, and the result is now that we can honestly say that their voices have been heard and their voices have made a difference. On behalf of our members, we thank the Arizona Congressional Representatives Gallego, Grijalva, Kirkpatrick, Halloran, and Stanton, and we also thank Senator Sinema and Senator Mark Kelly for their support of the Inflation Reduction Act. Thank you for being here this morning, Senator Kelly, and at this point I will turn the meeting over to you.
All right, thank you. Thank you, Joe. Thank you, Dana. Thank you, AARP, for allowing us to use your space here to talk about an incredibly important issue. And thank you, Judy and Kathy, for taking the time. This is an important issue. The cost of prescription drugs have been so high for so long, especially for seniors. And with the passage of the Inflation Reduction Act, we are finally going to lower the costs so seniors can afford their medication. When I talk to Arizonans across the state, I hear consistently about the high cost of so many different things, from gasoline to groceries, but more than anything else, specifically from seniors, I hear about the costs of their prescription medication. The people that have to make hard choices that, in our country today, nobody should really have to make, deciding whether to buy groceries that week or making a decision to cut medication, cut the pills in half and take half a dose, or in some cases, not taking the medication at all. And seniors, they get hit the hardest, especially when it comes to the rising price of prescription medication, because they are very often on a fixed income. And I've heard from seniors repeatedly about skipping medications because they can't afford it. So this started last fall, I worked with my colleagues in the United States Senate and the House to put together a plan that would finally address this specific issue. And the plan we put together would cap seniors' out-of-pocket costs for prescription drugs at $2,000 per year, but also spread out over the year. It would also hold drug companies who raise the price of their drugs faster than inflation accountable, and cap the cost of insulin at $35 a month. And for the first time ever, this legislation would allow Medicare to use its Medicare has massive buying power, and now can use this massive buying power to negotiate directly with pharmaceutical manufacturers to get the best deal, not the worst deal. That's behind us. And then this April, I chaired a hearing of the Special Committee on Aging, of which I'm a member right here in Phoenix, to discuss my plan and hear from seniors and medical experts about how this would impact them. So today we're back in Phoenix with some good news. I would say great news, that our plan to lower prescription drug prices was signed into law by the president yesterday. That's great news. And after decades of politicians from both parties promising that they would get this done, we got this across the finish line for Arizonans, for the American people who have been waiting way too long for this. And this is going to save At the same time, this doesn't only save the seniors money, this saves the federal government billions of dollars. And it allows seniors right here in Arizona to keep more money in their pockets. And it will keep them healthier by providing better access to the cures that they need and the medication that they need. Now, one of these people is Lisa Coe. She wanted to be here today with her husband Keith, but last minute she had some health issues and she could not make the trip here. Now, Lisa takes insulin as one of her 12 medications, and she has to ration that insulin because of the cost. And as I think most people realize, insulin is not optional for somebody who's a diabetic, if they're a type 1 diabetic. And overall, she and her husband pay $900 a month on Lisa's medications. Now, I know that Lisa and Keith have been strong advocates for the type of changes that we're talking about here today. And starting next year, Lisa's insulin will go from $650 per month that her doctor prescribes to $35 a month. And that is life-changing and transformative. Think about that for a second. She pays $650 for insulin that is not optional. And next year she will just pay $35 in any given month because of the bill that got signed into law yesterday. And on top of that, she won't be faced with the type of bills for her drugs that she does now. She will soon be covered by the $2,000 out-of-pocket cap. So I want to thank Lisa and Keith for their willingness to participate today and wish her a speedy recovery. And I want to thank all of you again for your partnership on this rather long road. This has been a long road to lower prescription drug costs by allowing Medicare to negotiate drug prices, just like the VA does, and ensuring out-of-pocket caps for seniors are now reality. So I want to go around the table and have everybody introduce themselves and say a little bit about why they're here today, and then I'm going to have some questions for all of you. So let me start with Dana.
Thank you. Is this on? Yes. Dana Kennedy, I'm the state director for AARP Arizona, and I've been in this position for almost 8 years, and unbelievable. But I'm here today because I'm so proud of what we accomplished, and it's amazing what you can do when you have, a lot of activists behind you. So I represent the 900,000 members in Arizona, and we have 38 million members across the country. So it's an honor to be here today.
Thank you, Dana. Kathy?
Hi, good morning, Senator Kelly. My name is Kathy Salisbury, and I have been on Medicare since 2000. Thank you. Since 2011, due to a disability that went undiagnosed for about 5 years. My medication was extremely expensive, so much so that it caused me and my family to be displaced. Upon my displacement and moving here to Arizona, it was very challenging. And as the challenge continued, and I am a mother of 3 now adult children, they were there to help me, but they had to have lives of their own as well. My medication for MS was so expensive that I was paying over $1,000 a month. And that caused me not to have a home. And as time went on, I'm now diagnosed with diabetes. Thankfully, the medication that my doctor has me on has my diabetes at a very wonderful, manageable level. But 1 month, I went from $44 for medication for my type 2 diabetes to $128. And when you have that amongst other medications, that is very difficult. I take 8 medications a day, and I'm so glad that this bill has been passed. This is going to help me. It's going to help people that I know, friends of mine who are disabled or seniors. And so I thank you that you've done this for us, and it's for everyone. Because even if you're not a senior yet, we hope one day you will be. And this is gonna be something that you're gonna have to deal with. I didn't know about it when I started this journey. I had a great job with wonderful benefits, that medication management was not my story. Now, as I'm older and over 55 and am unable to work to the capacity that I did, I know now the struggles of my parents. I understand the struggles of others who are faced with disabilities. So this is something that we need as Americans. This is what you need for your future. This is what you need for now. So I would just say thank you so much from the bottom of my heart and from my family, because this will allow me to hopefully save up where I can be a homeowner. You know, those things that are the American dream. And it shouldn't be just medication is your dream. It shouldn't be how am I going to take what I need today. It needs to be how can I have a wonderful quality of life? How can I have what others have and be well and be healthy? Thank you.
Thank you. Thank you, Ken. And I'm going to come back to you
Okay.
in a minute. Yeah, just hold on to that for a second, Judy. And Judy, I want you to introduce yourself, and then I have a question, for you. So just maybe a couple words about your background, not the whole story, because I want to get to that here in a question.
Okay, my name is Judy Wilson, and I was diagnosed with MS in 2010. And it was quite a journey to be diagnosed. As you've heard, it took over a year for them to figure out what was going on.
All right, Judy, let me stop you there, because I want to ask you about that. So remember in April when we saw each other, I asked you what the $2,000 cap on out-of-pocket expenses would mean for your life. And you told me that you'd like to get back on the drug Copaxone, I think it was, which is for your MS, which you stopped taking because it was too expensive. And you also said that spreading out the $2,000 across the whole year would be very helpful for your finances. And I remember telling you that the next time we saw each other, I'd hope that we'd be able to report back that we were able to accomplish this. And it wasn't obvious that we were going to get this done, and we finally did. But could you talk a little bit about that? What the $2,000 cap means, and also a little bit about the history of you getting off of Copaxone and how expensive it was, and what this means now for treating your MS.
Well, what happened was essentially the cost of the MS medication, Copaxone, I was getting subsidized by a foundation, but they finally didn't have any funding enough to support my needs. And so the net result is I had choices, and the choice was either pay a little over $7,000 a year for my medication or just continue using it. The choice was fairly obvious to me that I had to discontinue using it because I didn't have the funding to fund the medication. And so the net result is I'm no longer on my disease-modifying medication.
And how long have you been off of the medication now?
Over a year. I can't even recall, but yes, over a year, almost a year and a half at this point.
So then is the plan for you to get back on it when the $2,000 out-of-pocket kicks in?
Yes, because at this point, they're not clear, the medical community is not clear as to whether I'm putting myself at jeopardy or not as far as the disease progression. So yes, I wanted to get back on medication to make certain that I have a good quality of life.
Well, thank you, Judy. So Dana, you and AARP have been working on reducing the cost of prescription drugs for how long has it been? Long time? Just.
Well, I personally have been working on this issue my entire career with my master's in social work. So I started out in 1998 with my master's in social work, my first job in DC working for the National Council of Senior Citizens. And I remember getting a call one day from the White House actually, and they were looking for somebody to be able to speak at a press conference regarding their high cost of prescription drugs.
What year was that?
1998. And then, you know, I've continued to work on it. And then at AARP, I mean, this has been a huge campaign ever since we passed the Medicare Modernization Act in 2003. That act basically had a provision in it that didn't allow Medicare to negotiate. And it also, you know, still has some flaws. All Medicaid, or all bills, you know, legislation, they make some fixes, but sometimes you need to go back and fix some more. So that's where we are right now. So I just remember, you know, my great grandfather at 99, he died of esophageal cancer, and he didn't have medication coverage. So he used baking soda and water. And so I think that if he would have been able to use some modern medications, he probably would have been able to at least live to be 100. But he still lived to be a great 99 years old. So we've been working on this issue for a really long time.
Did you ever feel at any point that we got really close to fixing it and then kind of fell apart?
So, I mean, this campaign for myself personally and professionally at AARP has been, we have been, you know, in the target. And I remember meeting with you just 3 weeks ago in Washington, D.C. It was a Monday, and AARP said we need you to come to D.C. and we need you to get meetings with Kelly and Sinema and, you know, any of the Dems in the House, as well as any Republicans that will meet with you. And I dropped everything. I had booked a flight that Monday, flew to DC on Tuesday, met with you on Wednesday, met with Sinema after you on Thursday, met with Stanton and O'Halloran, and we just randomly met with Schweiker because I couldn't get a meeting with him right away, but still met with him. He happened to be, you know, on the same floor as O'Halloran. So we knew that that was a critical point. AARP, we have basically had about 8 million contacts with our members to members of Congress to get this done. So we have, you know, so when I met with you 3 weeks ago, I knew it was critical, but you got this across the finish line. And I have been working, you know, with any member of Congress on this issue. I, you know, remember 3 years ago, me and my team, we went and visited all congressional offices and, you know, discussed this issue. We did.
All 535?
Well, in Arizona.
Oh, Arizona.
But, and I even took my dog with me and we had stop the greet, you know, on him, and, you know, he had little boots on, and, but we visited everybody. I remember even lobbying McCain and Senator Flake as well on this issue. So, you know, we've been working on it for a really long time. So it's just, I'm pinching myself right now because we actually got it signed into law. And I just feel like a huge, immense accomplishment. And I'm so proud to have worked with you on this bill. You told me in April, I can't figure out why we can't get this done. You said, I'm talking to Schumer about this every single time I see him. So.
And other people.
And other people. So, I mean, it worked. And just really proud that we got it across the finish line.
And how many seniors do you believe will benefit in Arizona from this? Meaning, how many were paying over $2,000 out of pocket for their medication?
You know, I don't have the Arizona numbers in front of me, but we believe 5 to 7 million Medicare beneficiaries could see their drug costs go down because of the provisions. 50 million with Medicare Part D will have a peace of mind knowing that their pharmacies are capped at $2,000 a year. 3.3 million Medicare beneficiaries with diabetes will benefit from a guarantee that their insulin costs are capped at $35 a month. I should have brought that information with you, but if we need to get that, I can get it.
I think it's fair to say that across the country, millions of seniors will save billions of dollars when you do the math on this. So it's very impactful. I want to come back to Kathy, for a second. So are you on Medicare now? Because I didn't think you would be receiving Medicare.
I'm 55, almost 56, and yes, yes, I am on disability and have been since 2010. And so a year after you become legally disabled, your medication, well, your insurance starts to be Medicaid.
And how much do you feel you'll save each year because of this legislation?
Wow. I'd say $2,000 to $3,000 a year at least. I take currently 8 medications, so I at least $2,000 to $3,000, if not more. I'm probably undershooting that a little bit.
And one of the advantages to this legislation too is that the cost of these medications will not continue to go up faster than inflation. When we had this roundtable in April, I remember, and I can't remember if it was either of you, but somebody, maybe it was Dave, somebody said if the price of gasoline went up at the same rate as the price of prescription drugs since 2015, a gallon of gas would be $12 a gallon. That kind of stuck with me. I think the year was 2015. Yeah. So that's not going to happen anymore. And what that means is that's not going to undermine the benefit of the savings we're going to get from Medicare negotiation.
Yeah, and the other part of that is that there was that donut hole in there, where after you've paid so much, you kind of go into this, they call it the donut. Yeah, where you've paid so much that it really goes up to the other price. And that's where I was last year. And it was devastating because thankfully my doctor, I went to her and said, I can't afford this, and you know that I need it. And she was able to get me samples. If I hadn't had those samples, I don't know what I would have done. So.
Judy, between now and the time that the cap goes in effect, what's your plan for Paxton? Do you have one?
I don't have one.
Is there something we can do to help? Maybe there's another, like my staff, we can look around to see if there's another program where an organization is providing that. Have you done that recently?
I haven't done it recently because it's not the anniversary to get that funding.
Well, I've got somebody here, Catherine, somewhere in the back. We can look into this for you and see if there's something out there, because if you're planning on getting on it when the $2,000 cap goes in effect, maybe there's another option here before that. Well, thank you very much, everybody. I really appreciate all of you being here. I want to thank everybody for coming out today. It took a lot of work to get to this point. I mean, it really did, over a long period of time. I've only been in the Senate for 18 months, and in this 18 months, I feel we've got a lot done. And this is really a historic piece of legislation. Republican presidents even have talked about this, and Democrats. Finally, it was this Congress that got it across the finish line due to a lot of hard work by a lot of people, including other folks in this room, including Catherine back there, who works for me. And certainly we could not have gotten this done without the dedication and the hard work of AARP, an organization that's just done so much for seniors across our country for so long. So thank you, Joe, thank you, Dana, Kathy, and Judy. Thank you very much for being here.
I just want to thank everybody for being here, and it truly is a historic win. And allowing Medicare to negotiate, just to be clear, it's not price fixing, you may hear that. And this fight isn't over. So just because we get the legislation passed, we need to make sure that it gets implemented and that we don't make any changes to it. So just like Costco or Sam's Club, using your buying power to lower prices for your customer is common sense practice. Medicare provides prescription drug coverage for more than 60 million Americans, but for years it was prohibited by law from using that buying power to bring down prices. And just to be clear, $187 million was spent by the pharmaceutical industry to stop this from happening. And so we're going to continue to fight to make sure that this is implemented and that people get the relief that they need. And it's an honor to be here with you, and I can't thank you enough for getting this across the finish line.
Thank you, Dana. I just want to say one more thing. The other thing we didn't mention, just from a fundamental, fairness perspective, for so long, Americans have paid more than other countries for prescription drugs that are designed here and made here in the United States. And that's just been unfair. And you talked about the, pharmaceutical industry trying to stop this. Well, it helps many of us who don't take corporate PAC money. These are easy decisions. They really are. I mean, we want to, help, seniors across the state, across the country. And at the same time, pharmaceutical companies, do something so important, invent these drugs. They're going to be very successful and continue to be, and have the resources they need to come up with the next generation of medication and to extend people's lives and improve their quality of life. So thank you very much.
We're gonna hand it to you.
I was just going to mention that with these dramatic changes on prescription drugs, there are no reductions in the Medicare benefits. And there has been a misunderstanding out there that Medicare benefits are going to go down. They are not, they're remaining the same. So make sure we clarify that.
All right. Thank you, everybody. Thank you.
All needs a conference room for the back to the entrance.